This is Dr. Corey Maas on Looking Your Best. The FDA announced a clearance of a new drug called Kybella. That's Kybella. The name of the molecule is deoxycholate, and it's a product or derivative of mesotherapy. It's an alternative medicine way of injecting skin and theoretically tightening it. And they actually found one molecule, the deoxycholate or Kybella molecule, that does work, and it works by destroying fat cells when it's injected in small amounts in targeted areas. This product comes in solution. It'll be available very soon for doctors, and when it's being used, it'll be on label with the FDA. It'll be used in the neck area. I was a principal investigator on the study. It was used in our practice in over 300 treatments in the neck area, and we saw dramatic improvements in the reduction of chin fat and improvement of the contour of the neck, which would be an alternative to surgery, liposuction of the neck, or submental liposuction as we call it, for people who really don't want to have surgery. In the clinical trial, the patients had treatments about every month until they were to a satisfactory range of improvement. Most of those required about 4 or 5 treatments at monthly intervals. And in a small subset of the patients, there was pretty dramatic swelling underneath the neck, which may make people think twice about choosing between Kybella and liposuction under the neck when they're choosing that as an alternative. What's more exciting to me as a principal investigator and researcher in this area are the other applications that Kybella will surely use. We have several protocols we're already submitting. As physicians and surgeons, we're allowed to use approved products in off-label fashions, and I'm very excited to announce that we'll be offering Kybella treatments for the treatment of cellulite, for the treatment of areas that are very difficult to treat, like liposuction irregularities on the abdomen, hips, back, thigh, legs, areas like that. These are areas where liposuction commonly can have small bumps or lumps or irregularities, and it's my feeling that Kybella will be very effective in smoothing out or reducing these lumps or bumps. So if you have questions about, or if you've ever had liposuction and you have a little lump or irregularity, divot, something like that, please give us a call at the clinic, and we'll be happy to talk to you about it, or you can write me at drmaas.com. Along with that list of applications, I've already mentioned cellulite, and liposuction abnormalities, but there's great hope in my mind for example, men who don't want to have liposuction surgery for love handles, or maybe they just have little love handles and want some corrections. People who have had cool sculpting or other types of fat reduction treatments and have a little bit of an edge where the treatment window will be excellent candidates for softening those little ledges or edges, the bathtub deformity as it's often called. And cool sculpting is very effective in reducing fat, but it's only in the area that the applicator head is applied. So these are applications along with things like bat wings, the sort of fatty hanging tissue under the arms, the tops of the knee area, are areas that are very difficult to treat with liposuction or any treatment outside of extensive surgery like lifting the leg or circumferential brachial arm reduction. Brachioplasty is what it's called. So I'm quite excited about the applications that are off-label applications, in fact more so than I am about the neck. Liposuction of the chin and neck takes about an hour. People have really only a few days of recovery time wearing a little chin strap. And so we'll certainly be offering the non-surgical option with Kybella, and I'm very happy to do that with over 300 treatments done already. Liposuction surgery is still a very good alternative, and people will have to choose between those. Just to get a little bit into how this works, again, the molecule is now pretty well understood. It's injected as a solution. It stings a little bit, but not anything significant when it's done properly. It's done just below the skin surface or into the deeper fatty tissues below the skin surface. And the product itself, through a process, causes the lysis or breaking of the fat cells. And when the fat is released that's inside a fat cell into the tissues, it sets up an inflammatory reaction where macrophages and the other cells of inflammation come up and gobble up this fat. There is no elevation that was measured in serum levels or the blood circulating levels of triglycerides or fat, but this inflammatory process in my opinion, seems to be an important part of it because it also creates some contraction or tightening of the skin along with the loss of fat. And that may be as important as the destruction of fat cells. So I'm very happy to introduce Kybella. I'm going to post some important things on our website at maasclinic.com. All of our patients can see it on our educational platform. And certainly, if you're interested in this, follow us on facebook.com/MaasClinic, along with my Twitter feed at Dr. Corey Maas. As always, it's my pleasure to talk about new technologies, and I'm excited to be talking about this, expecting a lot of enthusiasm and a lot of energy generated about this new option for us to destroy unwanted facial fat and fat on the body. This is Dr. Corey Maas on Looking Your Best.